Preparing for cataract surgery is a big deal, and it shouldn't be taken lightly, especially when it comes to choosing the intraocular lens that's going to be implanted. Pretty much everyone in the modern day who goes through cataract surgery has an intraocular lens implanted. This is because without this lens implant, the person would need to wear extremely thick glasses in order to correct their vision. That's because the lens is responsible for bending about 1/3 of the light that comes into the eye so that it lands on the retina exactly to give you a clear image. If this lens is not there, that light is not going to be focused on the retina and the image is going to be very blurry. So compared to back in the day when they didn't have this technology available and had to wear extremely thick glasses, now what we can do is replace this cloudy cataract when it's out of there with a thin intraocular lens that the doctor gets to decide based on the patient's particular needs. If you're already a little lost, I would recommend that you go ahead and watch my other video about cataracts here. Making a lifelong decision like this, choosing your intraocular lens, can be very overwhelming. And sometimes appointments with doctors are so short and they can feel rushed, and you can leave with so many questions that you don't even know where to begin. And then you find yourself just kind of spiraling in confusion and not knowing which direction to go. So I'm really hoping to clear up some things and at least kind of steer you in a direction or give you more background information that can help you kind of come up with a clearer vision of what you might want for your future after the cataract surgery. There are a number of different intraocular lenses that can be implanted into the eye during cataract surgery, and they can correct the vision in various ways. And companies are always coming up with new designs to try to improve the quality of vision in as many ways as possible without sacrificing clarity of vision. We're going to talk about what that means in a little bit. The simplest intraocular lens option that patients have is a single vision lens. This lens corrects vision at only one distance and does not correct for astigmatism. So if you're looking to be independent of your glasses for the most part, this may not be the best lens choice for you. Although there are some patients that won't be candidates for the more complex lenses, and we'll talk about the reasons for that in a little bit. But basically what you want to know with this single vision or standard lens is that unless you have a very simple glasses prescription, it's not going to correct your vision the full amount. People with this type of lens implant should be prepared that they will need to wear glasses for at least some tasks following cataract surgery, and they may require bifocals as well. It all depends on what your prescription is before the surgery or what your particular eye's needs are. I want to break that down a little bit. Let's say, for example, that you wear bifocals and your prescription is just a simple spherical prescription. So if you look at your glasses prescription, it says sphere, cylinder, axis, and add. If you have numbers in the sphere and the add only, then the standard lens could be a good option for you. Let's say that your doctor and you choose together that it would be best to correct your vision for far distance. Basically what the lens is going to be doing is taking away the job of your glasses in that spherical column. So you won't need glasses anymore to see at far distance, but you will need to wear glasses when you're reading up close, or usually for computer work as well. And since people often look at computers and books or near objects at different distances, you'll often need different glasses for your computer versus your near. The nice thing is most people do well with the over-the-counter glasses at 2 different powers for this. So rather than getting 2 expensive pairs of prescription glasses, that option is available, which is, I think, a little bit comforting. Some people with myopia have the perfect prescription to be able to see up close, and they love that they can take off their glasses to read. Now, if you're somebody with myopia and you're going into cataract surgery and you think, oh wow, finally my distance vision can be corrected and I won't need to worry about wearing glasses all the time anymore. Well, that can be true, but if you just get this standard lens implanted and you don't correct for that near vision, suddenly this person is now wearing glasses to read. And if you've been used to your whole life wearing glasses for distance and removing them to read, and loving having that clear vision so you can lay on your side in bed and read up close without anything, this can be a real hiccup in your regular routine, and some people really don't like that. This doesn't mean that people with myopia shouldn't get their distance vision corrected. Some people may have been wishing for this their whole life, and they really want that, and they're fine with the idea of wearing glasses for near. It's just something to think about as you make this decision, because it is a big one. When it comes to cataract surgery, when the blurry cataract is removed and a new really thin, clear lens is placed in its place, it's not just free floating in space there. It's actually implanted into something that's called the capsular bag. It's like a very thin, clear membrane, and it actually adheres to this membrane over time. So it's much more complicated to remove this intraocular lens implant than it was originally to remove the cataract itself. Because if it adheres to that capsular bag and the capsular bag gets damaged, it changes the way that a new intraocular lens implant can be placed into the eye. So doctors are very wary to go in and change whatever lens you had chosen before just out for another lens. Plus it's a whole nother surgery to go through for you. So it's really best to try to think about what your options are and think about what you want so you can make the best decision for you on the first shot. It's a lot to think about, I know. So if you're one of those people with myopia who loves to be able to see really clearly up close, what may be an option for you is to keep a similar prescription to what you currently have. So this would mean that your vision is actually corrected with the intraocular lens implant to be at its optimum for your near work, and that you'll still need to wear glasses for distance. Another scenario that may require somebody to wear bifocals after they have a standard lens implant or the single vision lens implant would be somebody who has astigmatism. So if your prescription looks like this and has numbers in the cylinder and the axis column, that means that you have astigmatism. This single vision lens does not correct for astigmatism. So not having the astigmatism corrected by this single vision lens will require you to wear glasses for distance to have that corrected for your best possible clarity of vision after the cataract surgery. Plus, you will need to have that bifocal as well. A third scenario that's important to think about is somebody who may not have an ad power on their prescription at all right now. So sometimes people who are quite young do get cataracts and need cataract surgery, and they might not be wearing reading glasses yet. It might come as a shock to them that they would need to be wearing reading glasses after their cataract surgery. Or sometimes when the doctor is discussing the intraocular lens implant options, the person is thinking, oh yeah, well I'll get it corrected for distance because I see fine up close. Well, that's not going to be the case anymore. Your natural lens in the eye is what has been responsible for the focusing of your vision. So when you look from far away to up close, the shape of your lens actually changes to focus your vision at that different distance. If you no longer have your natural lens anymore and you have just this single vision lens, it is only going to correct at one distance, no matter what you were experiencing before the surgery. So really keep that in mind, that if you're going from having no reading glasses before the surgery because you simply didn't need them, you may need them following the surgery. So if you're not so happy about that, it may be better to consider some of the other lens options. Before I get into too much depth talking about these other intraocular lens implant options, I want to give you some of the reasons that people may choose not to use these lenses. Unfortunately, they do tend to run on the expensive side. Whereas a standard lens tends to be covered by a person's insurance, the other lenses tend to be an additional cost. Also, there are certain things about the anatomy of the eye that may limit what may work best for you, and this is where the conversation with your doctor is extremely important. Some people may have really large pupils just naturally, and these lenses might not work well in those circumstances because the function of these lenses can be slightly dependent on the size of the pupil. And if the pupil is too large, there can be way too much light bending in too many different ways, and it can cause a lot of glare or halos, and also it can affect contrast sensitivity. Another reason people may not be a candidate for these types of lenses is because of various eye conditions that they may have. One, for example, would be macular degeneration. Macular degeneration affects the macula, which is responsible for the very center of your vision. So if this area of your eye is not in perfect condition for cataract surgery, then your vision may not be optimal following cataract surgery. These lens implants that correct vision in more complex ways require really clear vision to function to the best of their ability. And if there's anything unusual going on in the macula, it will affect the clarity of vision, and the lens won't necessarily be worth the cost, but also it may hinder that person's vision further than if they had just gone with a standard lens and planned to wear glasses following surgery. Another example like this may be, for example, someone who's had a lot of different corneal procedures done, or someone with keratoconus, which affects the shape of the cornea. There just is too much complexity going on optically to get an optimal result following the cataract surgery with one of these more fancy lenses. Multifocal intraocular lens implants have been a very cool invention that can correct vision in a lot of ways that we couldn't just decades ago. There are a lot of different designs of these multifocal lenses that function in different ways optically, but I think the simplest explanation is that there are just concentric circles of varying powers within the lens. So depending on what you're looking at, different parts of these lenses are being used to focus at different distances. This is really cool technology that has made a lot of people much less dependent on their glasses. But there is one important thing to think about, that in some situations you will need reading glasses. One very common example that I ran into was that people feel like they still need to wear their reading glasses reading a menu in a dimly lit restaurant. That's because of these concentric circles, it requires a certain size of pupil sometimes to see at the proper distance. So if you're in a dimly lit restaurant, your pupil is really large and it's not eliminating those outer rings of power that are more for your distance vision. So if you don't have that smaller pupil, you're not going to have that really sharp vision that you were having, let's say, if you had a light directly on what you were reading. So these people in certain circumstances may need to carry some over-the-counter reading glasses with them when they're caught in a bind like this. A couple of other things to think about is that sometimes these lenses can cause halos or glare at nighttime, and that's just simply because of the way the optics work in the lens in order to get the vision clear at those different distances. There's always going to be a little bit of sacrifice involved. Also, some of these lens designs can affect contrast sensitivity, and contrast sensitivity basically describes how well you see something compared to its background. It's really important for the patient to think about how they will feel after the cataract surgery. Some people are just very, very particular, and they will be bothered if things are not perfect. Sometimes it's best for these people to go with a standard lens and just plan for glasses following the surgery so they don't run into that disappointment or frustration. But I'm definitely not going to tell anybody what to do here. It's very much a conversation to have with your doctor. You know yourself best, and they know your eyes best. So this is definitely a teamwork situation here. A lot of doctors' offices will have a technician who's there to further explain these lens options and talk to patients before they make that final decision. And that's all very helpful as well. Sometimes a doctor will have videos or a lot of handouts that are available, but it can still be really overwhelming. And if you ever go in for your initial cataract evaluation and your doctor wants you to make a decision on the spot, which really shouldn't happen. I've never seen offices set up in that particular way. But if you feel overwhelmed by that, you may want to step back and take a beat and say, I think I need to go home and think about this. Think about what you want for your long-term vision future before making a decision. Toric intraocular lenses correct for astigmatism. We talked before, you know you have astigmatism if you have a cylinder and an axis in your glasses prescription. Some people may have a low enough amount of astigmatism that correcting for it is not necessary when it comes to the intraocular lens implant, but for a lot of people a toric lens will be required to properly correct for their astigmatism so they won't be reliant on glasses for, let's say, distance following cataract surgery. Remember, if you get a toric IOL implant and that's it, remember that's likely going to be correcting your vision only at distance, and you would need to wear glasses for reading following the cataract surgery. But if you don't want to do that, there are actually lenses available that are called toric multifocal lenses. These would be a combination of the multifocal lenses we talked about and the toric lenses we talk about that correct for both simultaneously in order to give you vision at all distances and make you much less dependent on glasses. We talked about when we were discussing multifocals before, you may still need to wear reading glasses in dim situations or certain situations where you want to see something really small, but for the most part you should be much less dependent on glasses. Toric lenses and toric multifocal lenses, and sometimes just the regular multifocal lenses, require very particular placement by the doctor. The location of the lens has to be perfect. Astigmatism means that someone's prescription isn't perfectly symmetrical all the way around, and the prescription will vary depending on which axis of the eye you're looking at, and that's what the axis of a glasses prescription describes. In someone with astigmatism, there are two different main meridians. One of them will have the lowest power that the eye requires, and one of them will have the highest, and everywhere in the middle will be a slow change from one back to the other. So the axis tells us where this power differential is located, basically. That's kind of my rudimentary way to explain that. So as you can see, the location of the axis being important to correct your glasses would also mean that the placement of the toric lens to correct for this differential in power will be extremely important as well. And as we talked about before, it's not always so easy to go out and exchange these lenses or even to go in and slightly rotate these lenses if they aren't put in properly to begin with, but it can be done if the vision isn't quite right following the surgery. Some may be discouraged by the expense of the multifocal and toric lenses, but in some particular people, they may have another option as long as they don't have too high of astigmatism. And this would be with a monovision lens setup. Basically, this would mean that they would get the single vision or standard lenses implanted into each eye, but one eye would be ideal for distance and the other would be ideal for near. Both of my grandparents actually have monovision lens correction, and they've had this since well before I was born, and they both loved it. They have one eye for distance and one eye for near, and they do great. You might think that would greatly affect your depth perception, and it can for some people, so it's kind of hard to know who would be the best candidate for this type of lens correction. Some people think that you could try it out with contact lenses first and see how the person reacts to having two different types of vision at the same time, but it's not an exact comparison, so it might not really work. But some types of people that this might work out really well for are people who are just naturally born with different prescriptions in their eyes. There are people who naturally have about a 2 to 2.5 diopter difference between the eyes, and that's kind of the difference between far distance and where we typically read at about 40 centimeters. So people who have had vision like this their whole life, and maybe in their 40s they realized, hey, this is pretty cool. I can see far away with this eye and I can see up close with this eye, and I don't need to wear glasses. Well, for these people, it might be a great idea to get a standard lens at distance for the eye that's been seeing distance and a standard lens at near for the eye that's been seeing near. That might work out great for them. It's so difficult to tell ahead of time what might be best for each person, but again, this is just meant to be a guide to get you thinking and to help to clear some things up, since those conversations initially can be so overwhelming. But don't forget to have these conversations with your doctor about what your eye's particular needs are, what your goals are for your vision are of the utmost importance, and you two should work together very closely to decide what's going to be best for you. Hopefully you found this helpful, and I would love to see you next time. Thanks for watching.